smile, every hug, every kiss, every touch, every person in my life that I care about and love. But wait, maybe I'm getting too emotional. That's exactly what they say you ain't supposed to do. Suppress your feelings, never talk about your pain. Can't appreciate the sun without acknowledging it rains, right? That's right. So this a moment of clarity. And make sure you always protect your energy. You stay focused and your life gon' be lit. And you are now rocking with Celeste, the therapist. Let's go.
Hi, beautiful people. So let me just make sure my mic is close. Sorry. Okay. Hi. So if you are watching me on a replay, thank you so much for watching me. I appreciate you. My name is Celeste. I'm a therapist from Boston. I come on. I talk to people who are doing things to empower the lives of others by sharing their story. And the whole goal behind everything that I do is to just help you kind of shift the way you think. I always feel like we get so stuck in these negative cycles and we struggle with trying to figure out how to get out of them. And sometimes when we hear somebody's story that may sound similar to ours, or if we hear something that worked for somebody, it helps us think differently. I think in America, everyone is put into this box when it comes to everything, especially when it comes to health, which brings me to my amazing guest who I am going to add to the stream. And I am going to have her introduce herself to you guys. Let me just add her on. Hello, hello, hello. How
Hello.
how are you? Can you introduce yourself to the audience?
Yeah, definitely. Thank you so much for having me, first of all. Well, a little bit about me. So my name is Dr. Hanisha Patel, and I am a naturopathic doctor. And a lot of you probably don't even know what a naturopathic doctor is or what naturopathic medicine is because it's really not that common. But a naturopathic doctor essentially practices, or we're trained in primary care, but in a more preventative sort of way. So the way that we're trained is we actually learn to try to treat the root cause of illness and disease and work through it by that. So naturopathic medicine itself is actually the combination of it's a combination of putting together the rigors of modern science with the ancient wisdom of nature and bringing it together for a more holistic perspective on medicine and a holistic perspective for each individual. So we're looking to treat the whole person instead of just specializing in certain different organ systems or things like that. Of course, there's a time and a place for that, but we kind of are like this, usually the center, and then we then will refer out as needed. But our training, just a really quick background in our training, is we do have to go to 4 years of undergraduate. I actually got my degree in pharmaceutical sciences at Ohio State, and then I had to do 4 more years at Cider University, which is a naturopathic medical school. 2 years, the first 2 years are very similar to conventional medical school where we learn about the basic sciences. And then the next 2 years are a little bit more clinical, but that's where we get into learning about different modalities like nutrition, herbal medicine, physical medicine, homeopathy, and also pharmaceuticals and surgery as well, or minor surgery. And so we get a very wide range of studies in our practice, and we use all of those modalities in our practices as well, and I'm no different from that. So that's a little bit about what I do.
That's amazing. You just helped me like really conceptualize what you do. I love the fact that you bring in the what do they call alternative style.
Yeah.
And I know prior to science being involved in alternative style, that was the only style we had.
Right.
Why do you think? And after this, I want to get into how you got into this. But why is it that you think so much of our country only looks at the science and not the holistic whole person?
Yeah, definitely. So I will say for one, a lot of the indigenous practices actually are science-based. It's just a different type of research that they were doing in, before over, I think, conventional research, this double-blind controlled study, that really only came about a little over 100 years ago. So it's very new. Before that, they were using all sorts of like long-term studies, long-term or retrograde studies, or studies where we would do more observational studies, right? Just like focusing and figuring out like, oh, like these people in this kind of like who tend to have this type of skin type, or these people who normally tend to have this type of body type, they tend to be more like this, or they tend to have more issues with these diseases. And that's the type of research that they were doing. And then there was a lot of research within, like, it was a lot of trial and error, right? Like, is like things like turmeric that we hear so much about today has been used for thousands and thousands of years before this, because people realized the medicinal benefits of it, right? And so I will say that honestly, my personal opinion, based on what I know of history, because this is where history and science are so connected. Politics and science, clearly we're seeing with today, is so connected. And really the people in power can kind of shift the story, and that's the reality of it. And in my personal opinion, based on that, I really think a lot of indigenous practices got suppressed because of racism. And this is something that I feel like many people don't talk about, but all of the traditional medicines are now considered complementary or alternative, because it's as if anyone who practiced anything outside of Western medicine could not have been right. It was, and that's the way like it's been ingrained in us.
Yeah.
Right.
Yeah.
But there have been, indigenous practices all over the world, like indigenous American medicine, African medicine, Ayurvedic or ancient Indian medicine, Chinese medicine, all of these types of medicines. Like, it's so fascinating when you get into it. You're like, oh my God, they knew.
Yes.
They knew thousands of years ago, and we're relearning now.
Yeah.
And we're in a way discovering, but really we're not discovering, we're rediscovering. We're not discovering anything new, we're just rediscovering, and that is what it is. And so when I think about why it's been suppressed, that's where my answer always comes to. It's like,
yeah, and they make it harder because a lot of the things that you would prescribe, insurance doesn't cover. And
exactly.
I did not learn about people like you until I had a client telling me about seeing someone like you. And now I'm always talking to people about natural people that look at the holistic side of the issue. And it's a lot of people have found so much support from it. And speaking of the alternative methods, the reason why you even are in this field is because of your own struggle with autoimmune struggles. So can you talk to the audience about how you kind of stumbled on this path of your healing journey?
Yeah, definitely. So I've actually had my own personal health issues since I was born. So I was born with a lot of digestive issues. I was definitely a really colicky baby. And then around 6 months old, I had a hernia. And so I had to get a surgery done then. And so my digestive issues obviously didn't go away with the surgery, right? After that, I was on more antibiotics, which actually affected my digestion even more. And then I had asthma and allergies. And by the age of 9, I started experiencing chronic back pain. But I started my cycle when I was around 12 years old, and it was never normal. I never had a normal cycle until really about now, just like a few years ago. And so until naturopathic medicine. And yeah, what else was going on? Just a number of different health issues. And I would say the main things were like the pain that I was experiencing, that back pain. I also started experiencing some joint pain in college. And then my digestive pain, like anytime I would eat, I would feel pain, and it was super uncomfortable.
How all of the pains and all of the different, I mean, being sick since you were a child, how do you think that affected your mental health going through all of these different issues?
Yeah, I grew up in a family where, I mean, also being from the Midwest, I think there's a combination of the culture, and then also with the way my parents raised me, it was always like kind of like suck it up, right? Like you don't show that you feel pain, we like that and that's something that I'm still working on, is like, it's okay to feel, right? And so a lot of that I had honestly just suppressed, because I was like, oh, I mean, I'm in pain, but like, what am I going to do about it? And anytime I would reach out to doctors, because one of my big things, the reason why I was in so much digestive pain was because I was super constipated. I don't know if this is TMI for your listeners, but
no, it's fine. Let's talk about it. Everybody's been constipated at some point in their life.
Right. But I would have a bowel movement like maybe once a week. And and now I have a bowel movement every day, at least one, and I don't know how I dealt with it, because anytime I'm a little constipated now, I'm like, ooh, this is not fun.
Somebody's listening now. It's like you're supposed to move your bowels every day. Like,
every day. You gotta go every day. And if you're not, like, that's what we need to address, right? And so that was something that I dealt with for a long time. And then it was honestly not until I discovered naturopathic medicine that I realized that I didn't have to deal with those. Because by the time I even discovered naturopathic medicine, I thought it was something that was just my normal, which is what I was told so often by conventional doctors, was like, oh, maybe it's just your normal to have a bowel movement once a week. And I'm like, now I'm like, no, that is so not normal. It's so not normal.
Like, I don't know what else to tell you, lady. Like,
I'm like, we need to have more bowel movements. But like, but I mean, there's like a double-sided story to my journey, because I actually went into naturopathic medical school thinking I wanted to support people with more alternative routes, or more herbal medicine, nutrition, exercise, mindset, all of these things. But I didn't realize those things could help me, which is crazy. Like, I didn't think that it would help me and my issues, but it was at this point I had denied or like suppressed my issues anyway. I was like, oh, this is just my normal. So it was like a double-sided story, because I actually went into it because my degree was in pharmaceutical sciences. And as I learned about the medications, and then the side effects of the medications, and then the medications needed for those side effects, it's like,
it's a vicious cycle.
It's a vicious cycle, right? And I was like, this doesn't make sense. I would just sit in class and be like, I don't get it. Like, it doesn't make sense. And I'm so grateful that I'm Indian American, and I was born in the US, but my parents, Indian immigrants. And so a lot of times when we wouldn't feel well, they would give us like the turmeric lattes that have become so popular now. Like, we would drink that all the time when we didn't feel well. And I remember it helping. And so I was like, you know what? Like, why don't I explore my own, like my ancestral medicine? And that's a part of why I became so passionate about like getting back to our roots and understanding the ancestral connection between medicine and where we are today. And so that's where I went to India, learned a little bit more about Ayurvedic medicine. And I was like, and then I actually also traveled to Guatemala and learned about their traditional medicine. And from there, that was when I realized, I was like, okay, so there are other things that work. We just don't know about it, right? We're just not taught about it, probably just because the white man doesn't do it. And just to be completely blunt, like that's where I had that realization, and then continued my journey from there.
Yeah, I always say that, you at late at night, I'm going to answer your question, Crystal and Donald. And then I want to go into gut health. But I always listen to those commercials where they talk about, are you depressed? And they say like, well, take this. And then they name like 20 million side effects. But I wish there was a commercial that says, are you depressed? What are you doing? What are you eating? How are you sleeping? But I think about that, and I know that no one's going to get paid if we're well, right? They don't get paid if we're well. So sometimes there's a cycle where we stay sick because we're not educated about the things that we can do that's within our control to keep our mental status well,
Yeah, definitely. And I love that you brought that up too, because I was recently reading how we've increased the amount of antidepressants that we prescribe about 400-fold in the last 30 years. And right, like, isn't that crazy? And that's for people ages 12 and up. So starting at the age of 12, which is so young. And I'm like, are we addressing everything else before resorting to that? I don't think antidepressants are always wrong. You know, I don't think they're always bad, but are we addressing everything else before resorting to that? And I don't think the answer is yes.
I 100% agree with you. And when people come to me, and I talk, and I'm somebody that's not this person against medication, but I am against us doing what we can do first and let that be our kind of last thing that is within our control. But I just think that it's, this is why I started the podcast and have people like you on, to help give your expertise around this subject. Crystal wants to know, how does she find a doctor near her? She wants alternative holistic doctor in her life.
Yeah, definitely. So you can search, there's a website, the organization is called the Institute of Natural Medicine. That's where you can search a doctor near you. And a lot of doctors, including myself, do see people virtually too. So if you can't necessarily find someone near you, I think the virtual route is super helpful. Like I have some patients who like live in the country, and so it's hard to find a holistic practitioner who lives in the countryside, right? You might find a few in the city, but that's really it. So I think that's helpful there. But yeah, Institute of Natural Medicine is a great resource.
Donna wants to know if you incorporate fasting in your regimens.
Ooh, that is a great question. So I love talking about fasting. Fasting is something that, again, I'm the type of person who always wants to bring it back to the history. I love talking about the history of medicine because it's something I'm super passionate about. But we've been doing this for thousands of years. We've been fasting for thousands of years, and it has numerous benefits. The only problem is, today, the way we've kind of set up our lifestyle, it may not be ideal for every single person. So there are certain situations where I have seen, and it depends. So like if someone has like lower blood sugar levels normally, fasting is probably not the right move for them right now. I know I personally was trying to fast because I thought it was, healthy. I thought it was good for me. But at that time, it was actually really bad for me. But now I'm at a point where I've been able to heal that side of my blood sugar, and I am able to fast, and I do it regularly. And so it kind of depends. And so that's why I definitely don't like that everyone just promotes fasting and just doing it all for everyone, because it isn't for everyone.
Culture. It's like the diet culture, right? Yeah.
Exactly. It's not for everyone, but it can definitely be beneficial. I usually say, if you can, at least try to keep 2 to 4 hours between meals, because that actually activates something called the MMC, or the migrating motor complex, in our gut. And that's what helps us like remove the toxins. I consider, like, in my mind, I see the MMC as like the vacuum that just goes through our gut and is just like cleaning things up. And it can only be activated with fasting for at least 2 hours. So that's one thing I usually just try to recommend in general, though.
I'm going to take these 2 questions and then we're going to go into gut health. I'm kind of afraid to go into gut health because I feel like I'm going to be hit over the head about things I'm doing. But let's get these questions in because I'm doing this for the people. So I have to get myself
Knowledge
together.
is power. Knowledge is power. And I mean, this is the thing with the diet culture and all that stuff too. Like I always say that we need to give ourselves grace throughout the process. Yeah.
How can we support natural medicine for those navigating substance use disorder?
How can we support natural medicine? Do you mean like how can we use natural medicine to support those with substance use disorder?
Yeah, I'll let her answer. But obviously with substance abuse disorder, it's pretty challenging. And I think just to kind of answer it from a physiological chemical side of it, when people are trying to get off of substances and they've been using it at high levels, it's going to be hard to just go cold turkey naturally because their body can go into shock. She says, yeah, that's what she's asking.
Okay. Yeah. No, and exactly what you said.
There you go.
Yeah. No, it's exactly what you said, that we definitely want to work with a few different providers, usually when it comes to substance abuse. I mean, honestly, a lot of things. I rarely work alone. I help patients who are on antidepressants get off of antidepressants, but I always work with their psychiatrist as well, and their therapist, and we like have conversations. And that's what I think really is the future of medicine and what I try to embody. But yeah, that's the same thing with substance use disorders. There are ways that in terms of natural medicine, there are a lot of nutrients that get depleted with substance abuse. And so the way that we can support as naturopathic physicians is by helping to replete those nutrients, and then potentially, again, it depends, potentially recommending some herbal medicine that can be supportive, but there could also be interactions with those medications. So we have to be very mindful.
All right, I keep saying that, but I never had so many questions coming at one time. What does your diet look like? And then should I drink raw apple cider vinegar on a daily basis? And everybody's diet looks different, Crystal. We all can't look like Dr. Hanisha.
Yeah, no, and that's exactly it. So that's exactly what I was going to say, is that every single person's diet is different. And even with pretty much every patient of mine, I do recommend different diets. And so I use, whenever I'm recommending for my patients, I use a combination of the blood type diet. I use a little bit of the Ayurvedic medicine model, and depending on the
diet?
So the blood type diet, Dr. Diamato, I was like, what is his name? He formulated this blood type diet, which was based off of actually Japanese indigenous medicine. And so based off of that, he determined that there are certain blood types that do better with certain types of diets.
I didn't know that.
Yeah, it's super fascinating. And I think I got into it more because of the history behind it. And like, so you get into like, okay, people with like, let's say O positive blood type or O blood type, they tend to be, so the O blood type was the original blood type that humans had. So the first, you're original. And yeah, and so like, so that's like the OG blood type, right?
I'm an OG. Oh my God, you just made my day. Thank you. All my O positive people.
There you go. And so but with that comes comes the diet, right? Like, what's an optimal diet for someone who's O positive? That is usually what our Paleolithic ancestors ate, right? So we go back to the original diet then too. And so that's not really having like agriculture wasn't a thing. You know, agriculture came up only about like 20,000 years ago, technically. But if we go into like areas, so Africa was where we all originated. And so that's where that blood type originated. But if we like go on to like Asia, the Middle East, we'll see more people with like B blood type. And then eventually a mutation happened of the A, and then eventually the AB blood type. And so
the AB's the last. AB's y'all the last.
Y'all the newbies.
That's why we can give blood to everybody, because we're the OGs.
That exactly. So yeah, exactly. So yeah, so it's fascinating whenever you get into all that. But I also use Ayurvedic medicine or the ancient Indian medicine to figure out, and I also use the labs that I get, and so like modern science-based nutrition as well. So I kind of use a combination, putting it together, figuring out what's going to be ideal.
He's saying, yeah, vegan. So is it it was a vegan lifestyle at first?
No, it wasn't actually. Okay. So it's like more of the paleo, like for the O blood type. Again, the vegan diet might be ideal for you, but and it might not correlate with that, with your blood type, you know. So it also depends on where you are in your life too. So that's where I hear a lot of people feel better with the vegan diet. Usually that's because most people weren't eating that many vegetables at all. So finally they're eating some veggies, and so they're feeling better, right? And so that's where they're feeling better. But usually the Paleolithic ancestors, they were having a lot of vegetables, some fruit, and then they were actually eating meat, but more wild meat. So usually what I recommend is avoiding the more factory farm meats. So like beef and pork and chicken, which are probably like the things that most people eat most of.
What else is there? No, I'm just kidding.
Well, like, and that's kind of where I usually, so I'm not O blood type, I'm the B positive blood type. But so Well, the B positive blood type actually came from the Mongols, so I thought that was a pretty cool
Oh,
story
that's
as well. So we were second. We were second, and but that's why we are closely related to the O, where we have a similar type of diet. Um, but yeah, so I usually eat in terms of my meat. I will have more turkey, lamb, goat, bison, just wilder meat in general.
all right. And then the last question, should I drink raw apples, cider, vinegar on a daily
Yeah,
basis?
that's a great question, because I feel like this has become super popular. And honestly, I have found it to be very helpful for most people. And I don't think there's very many like negative side effects to it. So I would say go for it. I think it's a great way to just work on balancing out your stomach acid. So yeah, I would say go for it. But of course, every single person's different. So I can't say how you'll react to it, but you
But
can
you're
try it
saying
out.
it balances out our stomach acids.
Right. Yeah.
Okay. Now, speaking of stomach stuff, let's get into
Yeah.
this gut. Let's get into the gut and
Yes.
figure out what's going on with the gut.
Let's do it.
So one of the things that a lot of people I've heard talk about is this correlation with the gut, brain, mental health. Talk to people a little bit about that kind of connection that you've seen.
Yeah, definitely. So yeah, I think this has become a very commonly said thing, the gut brain connection. And I don't think people talk about the gut mental health connection as much. But what I want to make clear is that your brain health affects your mental health, and your gut health affects your brain health, which then therefore also affects your mental health, right? So it's all connected, and almost everything in our body is connected. So if our hormones are out of balance, then it could be associated with our gut. And so that's just something that I feel like we've lost, but we're starting to come back to. Like, we're starting to come back to it now that everything is connected. And so with the gut brain connection, I think it's important to start with what is the gut, and then what is the brain. And so the gut, what I don't think most people realize, is includes all of the organs in our digestive system, starting from our oral cavity, so starting from our mouth all the way
Dr.
down to our anus.
Hanisha, I did not know that. I thought the gut was just my stomach.
Right. No, it goes far beyond that. So it's literally everything from here in our mouth all the way down to our anus. And so that's including our colon, our liver, our pancreas, our stomach, of course, our small intestine, all of these organs that are in our digestive system, the esophagus, so that's where if anyone experiences symptoms like heartburn, bloating, constipation, diarrhea, reflux, nausea, vomiting, all of that's associated with your gut. And so that's the gut. But how it is then connected to the brain, which is obviously, the brain is the organ that controls everything. It's telling me to make all these hand movements right now, which I know I probably do way too much. But that's what our brain is doing. It helps, and it gives us a sense of smell, taste, touch, all of these things, but then also gives us the motor control, where we make voluntary movements, we make voluntary decisions, things like that, right? So it controls what we don't think about all the time, like breathing, but then it also controls things that we can focus on and change, right? Like working out or whatever. And so with that connection, then there actually is a physical connection between the gut and the brain, and that is via the vagus nerve. And the vagus nerve is something that is connected directly from our brain to every single one of those organs that I just mentioned in our gut. And so it is fascinating. I love talking about the vagus nerve because it's just so cool. And we'll talk about, I love talking about ways to activate the vagus nerve. So we'll talk about that in a second, but that's one way that it's connected. And I want to remind everyone that it's bidirectional. So that means that what we put into our gut, so that's of course the foods and whatever affects our gut, so movement or lack of movement, all of that can affect our gut. It's actually really fascinating because there's studies that show that the gut, and any sort of exercise can actually alter the gut microbiota. So if we're exercising, then we can actually optimize our gut microbiome just by exercising. And I feel like that's something people don't think about. You just think about food, gut, but
Sorry,
exercise
because
also
I'm just
affects that.
thinking about my audience because they may know what this is. What's the microbiota?
Yeah, so the gut microbiome is this ecosystem of bacteria, fungi, viruses, and maybe even some parasites that, and we're finding that some, I don't want to scare people with parasites because we're finding that some might actually be supportive and, commensal, which means that we work in unison with them. And that's the same thing with the bacteria, fungi, and viruses too. So in terms of the bacteria, we have over 10 trillion bacteria in our gut alone, 10 trillion bacteria in general, and that's about 100 to 1,000 times more than we have human cells. So, that's how much, so there's people will ask the question, are we really bacteria or are we human? Right? We don't really know. But these bacteria will, the way that it can also affect our brain, whatever is happening with our bacteria, is because these bacteria can create some end products called postbiotics. So we hear a lot about probiotics, but these bacteria will create postbiotics, which are essentially chemical messengers that can go into your bloodstream. And so these messengers can go into your bloodstream and then send signals to any organ system, and that's one of them could be the brain. Right. And so that's how your gut microbiome can affect your brain. And what we want is, because like I said, we have great bacteria in our body because that's how we stay alive. But when we don't, so this is kind of, I don't know, I'm going to give you a little analogy, and this is simplifying it so much. But the way I think about it.
I need that. I need that so much.
Yeah, we all do. I mean, I feel like I learn better this way too. And so this is the way I learned it, and this is the way I essentially teach it too. But yeah, I think of it as think about, the antagonist versus the protagonist, right? If we're at war with one another, there's the good guys and the bad guys. And with whatever we do with our diet, with our lifestyle, with our mindset, with our lack of or type of movement, all of these things, sleep, all of these things can alter the gut microbiome. And so if we're eating nourishing foods, if we're sleeping well, if we have a positive, optimistic mindset, if we're exercising regularly, if we're doing all these things, we're arming the good guys, right? So we're just giving them the arm, right? We're arming the good guys and depriving or starving the bad guys. And that's what we're doing. But if we do the exact opposite, right? So eating, McDonald's all the time, or sitting on your couch all day, never actually walking or moving or doing anything like that, having negative thoughts, that's what arms the bad guys, which of course we don't want. But those bad guys can then kill off some of the good guys, and that's where a lot of the gut issues and kind of overall health issues really start. Yeah.
And that's and I think there's no way to because the gut stuff that goes on, for instance, a lot of my clients who have had some constipation issues or some migraine issues, and then I started talking. I'm not a neuropathic doctor, but I understand how everything works.
Yeah.
And I was able to show them around the times of high stress, constipation comes in, it's activated, right? Or the migraines is usually around stressful events, right? The more I speak to them, the more I start to realize there's this correlation. And then people actually start to see it. But usually, when they go to the doctor, it's usually thinking more about what they can take for the constipation or what they can take for the migraine, and not really going deeper to the issue. And a lot of times I've noticed that it's very much stress related. It's going on around what's happening in their environment.
Right, definitely. And stress can alter your gut microbiome so much and so quickly. And so it's actually fascinating. There's a study where they found patients with ulcerative colitis, how it would actually trigger the ulcerative colitis would actually trigger anxiety, and that stress response would be greater. And what they did to test that connection was they actually induced ulcerative colitis in rats, then to see if that would also trigger anxiety. And it did. It did. And then they also found the other way around, where patients with anxiety were more likely to have ulcerative colitis flares. So clearly showing that connection. And I know so many patients who, like, they have an anxiety attack or feeling super anxious, they get nauseous, right? Like, that's your gut. That's your gut that's affected directly. And so yeah, so that's why I like talking about the bidirectional effect, because our mindset affects our gut affects our mind.
Yes, that makes so much sense. And if somebody's listening to this thinking about, how do I start to, right now take care of my gut health? How do I start this process? Because I really believe we can, like, work with what we have and empower ourselves in that way. So what would you say to somebody like that?
Yeah, for sure. Well, yeah, there is really so much that we can do, and I really like to focus on the foundations first, right? So making sure, of course, starting with like nutrition, which is something that I feel like we all inherently know, but we're kind of afraid to to talk about. But trying to just, I don't really usually recommend too much. Like, I don't agree with diet culture. I don't promote it. I don't condone it. So I just usually recommend just incorporating more vegetables into your diet. I personally, at this point, I try to get at least 7 to 9 cups of vegetables a day in my diet. And that is ideal. And
The vegetables are going to arm the good guys.
exactly. And they have fiber, right? So the daily recommended amount of fiber is honestly despicable because it's only about 20 grams, and that doesn't even allow you to have a proper bowel movement every day. So I usually recommend trying to get at least 35 grams if that's something. And these are things that I'm always like, okay, count in the beginning, but then whenever you get the hang of it, just eat the food, right? Just don't let it consume your life, but like count, maybe like in the beginning when you're trying to learn and figure out, you can be like, okay, like how much fiber am I getting now? And then but yeah, like I said, try to get at least 35 grams. Our Paleolithic ancestors were actually getting about 100 grams a day of fiber.
Dang,
So
they was crapping all day.
yeah, they were. And then they were also moving all day too. And so that's the next step, right? Making sure you're getting some physical activity. One thing that I always say is I really don't care what you do as long as you move. So whether it's going on a run or walking or doing yoga or Pilates, bar, any of these things. And, it's the one beautiful thing that's come out of COVID, I think, is that there are so many free online resources now that are amazing. Like, there's so many amazing people out there, and I mean, I use them for my own personal exercise habits. But yeah, just getting some sort of movement in is, I mean, and I think we're finding even more the connection between exercise and mental health too, and that's super important.
And then I'm gonna answer your question. I'm gonna put your question up, Ms. Pilaf. But and then, how does sleep play a role in it? I know
Yes.
a lot of people may not understand the value in sleep. And when three things I tell people, and I'm always incorporating this in my talks with people in my practice, is, what are you eating? Are you moving your body? And how are you sleeping? And then
Yeah.
people at first are like baffled. Why am I talking about this with a therapist? But I'm letting them know that it's all connected. So how
Yeah.
important is sleep to our lives?
Definitely. Oh my God. Sleep is absolutely essential, right? Like, we need to, oh, I forgot that we also need to get enough water too, in terms of nutrition. But like, we need food, water, sleep, right? Like, those are some of the main things that we need. And sleep has also been shown, like, they've actually done studies where they deprived people of sleep. And by deprive, I mean they were still sleeping 5 hours a night. And I know plenty of people who don't even get that much sleep,
Mhm.
right? and I think, again, we have this like hashtag no sleep culture thing going on,
It's
and that's not helping.
horrible. I cringe when
Yeah,
I see it. I
me
cringe.
too. I'm like, no, hashtag sleep, hashtag sleep. But yeah, it's absolutely essential, and they found that that can alter your gut microbiome. But what I do want to mention, so I mentioned how these things can negatively alter your gut microbiome, but I do want to mention that like changing your diet, like just eating more whole foods within 24 hours can help alter your gut microbiome in a positive way. So it really doesn't take that long to start making a switch. It's not like, of course you're not going to feel amazing right after, but that's how quickly your body can adjust. So that's a beautiful thing about it. But going back to the sleep, one thing that I do like to let people know about is that the prime restoration time, especially for our gut or our digestive system, is between 10 p.m. and 12 a.m. because that's the time where our melatonin levels should be at its highest. And therefore, when our melatonin, because our melatonin is also very supportive of our gut health, when our melatonin level is at the highest, it can help with restoration of our gut. So if we're not sleeping by midnight, I mean, sleep is still sleep and you still want to get enough sleep, but it still could be affecting our digestion. So I've had people who would get 9-10 hours of sleep and they like, they're sleeping fine, but their gut is still out of balance, and we just kind of shift it. I'm like, all right, go to bed a little earlier.
Yeah.
And just that simple shift can make a difference
Wow,
for health.
that's
And
incredible.
yeah,
That's really incredible. It's the little things that we don't know about.
it is. Yeah. And I do want to mention, like, I want to give people tools, right? So like, if you're not sleeping well, then what can you do? And there's something that I like to call sleep hygiene, which is kind of, we have our hygiene for our bodies and our ourselves, but there's also sleep hygiene where we make sure that we're turning off all our electronics before we go to bed. These devices are amazing and have clearly keep us connected, which is awesome, but they also emit electromagnetic frequency, which can also it's theorized. We don't have like a solid proof of this, but it could potentially be lowering melatonin production. And so avoiding that, or using blue light blockers, like when you watch TV in the evening, but also not watching TV too late into the evening, right? Avoiding all of those things. And then if you're having multiple thoughts, I mean, I honestly just recommend journaling for everyone because I think it's super helpful. I'm sure you you can attest to that. But yeah, journaling is great.
So yeah, the sleep hygiene for my listeners is something to really think about. I think, obviously everyone knows hygiene more so for physical and taking a shower. And it's something
Right.
that is kind of second nature for us. As adults, we know how to take a shower and that we need a shower. And
Wash
so
our
I kind of want
hands.
you to wash our hands, right? And so I
Yeah.
want you to take that same mentality when it comes to your sleep. And so this is something I'm still screaming at my kids to take a shower. They're still kids, so they don't care about their hygiene. But the more I talk about it, eventually it's gonna be second nature for them. They're gonna realize they stink and they need to take a shower. And so, your sleep is off. So really think about, what can I intentionally do? To put the phone down, make sure the TV's off. Maybe I need to write out what I need to do for tomorrow. I'm worried about tomorrow. Let me write it out. And so really start to give yourself a routine. Our brain loves structure. And if you don't have structure for the nighttime, it's just going to be out of whack.
Completely. Yeah. One of the things I say is beds are only for sex and sleep, and that's it.
Not laying around watching TV all day.
Yeah, exactly. Don't bring your work to bed. Don't watch TV on bed. Just like they're for sex and sleep, and that's it.
Grab a chair and put it next to your bed so you can watch the TV.
Yeah, exactly.
Miss P Love is asking says my grandmother suffers from how do you say that?
Varicose veins.
Varicose veins. What do you recommend for them?
Yeah, so varicose veins, first I want to make the disclaimer that I am not giving any medical advice right now. Everything I'm talking about today is really meant for educational purposes only.
So you're talking in general.
Yes, in general. So again, this can be almost everything that I talk about, every condition, I'm always going to start with the foundations. So we want to check if the foundations are in place, because varicose veins can happen when there's issues with circulation. So why are there issues with circulation? Is she having high blood pressure or high cholesterol? Is there a lack of movement, which is causing that? So it kind of depends on where that's coming from, but those would be kind of the foundations, again, to where to start from. Especially the movement piece, I feel like has really made a difference, from those that I know who are suffering from varicose veins. But then also I've seen like runners, like marathon runners, experience varicose veins because they're actually running too much. So again, the balance of everything, right? They're just running too often. And we see, these athletes, who focus on doing one specific sort of style of exercise. We see them have a lot of issues with different parts of their body depending on what they're doing, and that's because it's too much of one thing, and that can always also be a problem.
So thank you. You've shared a lot. I do want to ask you about 2020 March happens. You're in private. You're already doing Mahan Health at this point, right?
Mhm.
And what did you notice, in your practice, the shift in the things that people are struggling with, and what have you recommended for that shift?
Yeah, so it's been a huge shift, right? Like it's been a crazy whirlwind of a year, and it's been fascinating. So one of the questions I ask every single one of my patients is, or two of the questions I ask, what are your stressors and what are your stress relievers? And so after that point, pretty much everyone, I'm pretty sure every single patient of mine had the stressor of COVID, right? Um, Whether it was the fear of it or the lack of community, the lack of feeling connected, because we had become disconnected. I mean, we're literally supposed to be socially distancing, right? And so it was a very intense period. And then the lack of control, I think, are usually kind of the biggest things, because a lot of, I mean, we tend to like be able to control so much of our lives. And one of the things that I did notice in a positive light was those, including myself. I think I realized, because I usually have a lot of control over things in my life too. And as soon as I was able to be like, well, I have no idea what's going to happen and I have no control over it, and I'm just going to go with the flow, that was the moment where my personal anxiety started to subside. And I was like, all right, we'll just go with it. And it's actually been liberating in a way, because I've been able to practice that throughout this period. And but yeah, those were kind of the main things, and that those are conversations that I had with all my patients, is the ability and working with going with the flow, um, and trying to, so I also recommend doing like a gratitude journal quite often. Again, this can possibly affect our gut health or any aspect of our health in general. And one of the things that I recommend is every single day write 3 unique things you're grateful for. And so don't write the same things, like, okay, yeah, it's great to be grateful for your family, friends, food. Like, it's great. Like, we should be grateful for those things, but we gotta kind of change it up. Let's be creative with it. What else are you grateful for? Like, I'm grateful for my laptop for having this ability, or the Wi-Fi for this connection that we can have this conversation. Or I'm grateful for the, just the ability to to connect with my thoughts, and go inward, with
Mhm.
myself, and like whatever those things are, just like starting to be grateful for random things, um, helps you realize how great your life actually is.
Mhm.
Which, of course, we go through things. Of course, there are things that, it's harder to be grateful on some days. It definitely is. But the more we practice it, the more we can realize that there are so many little things, and that can help us live a more fulfilled life. And I think those two things of working on letting go control, and going with the flow, and then having this gratitude practice, were kind of the two main things that I've worked with on patients.
I love that. And, that's one of the things that has really shifted even before the pandemic. It's just kind of shifted my mindset. There's a physiological change that happens when you start to look at what you're grateful for. It really kind of changes. And I think what you're trying to say is like, yes, there are some times where it is hard to see what you're grateful for, but if you're practicing this, if you're writing it out, there's something powerful about writing it out, speaking it
Right.
into existence. And I think that on those harder days, it become a impulsive, natural instinct for you to kind of, yes, I'm struggling, but this, right? It's not
Mhm.
something you will have to work really hard for because you're already doing it, even on the days that are easier to do it on. Is that fair to say?
Yeah, yeah, definitely. And that's that preventative medicine, right? So the
Yes.
more you practice it when you're feeling good, the the easier it becomes. It doesn't become easy. I'm saying it becomes a little bit easier
Yeah,
whenever you are going through those
absolutely.
trying times.
Yeah,
Yeah.
and I always talk to people about their prescription for life, and I was like, "What is it that you need? Like, what Celeste needs and what you need are two different needs." And I
Yeah.
think that we can all look at what we need and look at it as a prescription, right? Because if I had diabetes, I'm taking my insulin every day, but that's like me trying to survive. And I think when we think about living, a lot of the methods that you talk about today allows us to live a more healthier and peaceful lifestyle where we feel like we have control.
Yeah, definitely. And I think that that's really my goal is like to have a more fulfilled and thriving life instead of
Mhm,
just trying to survive through life,
mhm,
right? Just making sure that, or not making sure, just like being able to.
mhm.
And when you can get into that position, it's just the most amazing, like
It is.
euphoric feeling. Yeah.
It's so good. Even I think before the pandemic, I've gotten into this mindset, and I didn't grow up thinking this way. I grew up think don't talk about it and like just swallow your pain. And the more I've been able to do these things that you talk about, I found myself really thriving, and that feels really good. Uh,
Yeah. Yeah, definitely.
So we love you. I know I love everything that you said. And for people listening to this or watching this right now, you guys don't have to stop loving her because she does have a podcast. Can you talk to people a little bit about your podcast? And you guys can follow it right now. You're streaming everywhere.
Yes. Yeah. So I'm on like Apple Podcast, Spotify, Google Play, or I forget what the Google one is called. But yeah, I'm all over the place. The podcast is called Mahan Health, which is the same as my practice. Mahan literally translates to great in Sanskrit. And because I was able to experience Mahan or great health, my goal is to help everyone else experience that too, because it's an amazing feeling. And so that's what Mahan Health means. And on this podcast, I interview a number of different doctors, whether naturopathic doctors or functional medicine doctors, on a number of different topics. So I actually just realized that my episode for today didn't actually post, so I'll make sure to do that afterwards. But this episode is actually very connected to what we were talking about today. And the episode is on your brain on food. um and so
Ooh.
yeah, it's yeah, her book is that's what it's her book is called, Dr. Uma Naidu, and she's amazing too. And so, and we talk about different foods that can support your mental health too, and we talk about ways that it could support you if you have depression, anxiety, ADHD, insomnia, like what foods can support you there. So that definitely check that episode out, and the other ones as well. But
Yeah,
yeah,
don't just
that's my
check that
podcast.
one out. Check them all out because
Yeah.
I've
Yeah.
never gotten so many questions back to back, and I posed a question: have people heard about what you do, and then also about the gut brain? And over 70% said no. So, and the fact that I have my master's degree and I didn't learn about it until I was in private practice says a lot about how
Right.
much we are depriving ourselves of looking at things in a holistic manner when it comes to our health.
Right. Yeah, definitely. And it's unfortunate, but that's why we're doing these things, to help get the word out there. And that's the thing, like I mean, if you're dealing with certain issues that you need a little bit more help with, we're always here to support. There's, like I said, that website, Institute of Natural Medicine, is a great resource to find a naturopathic doctor near you. But there's also so many things that I'm like, you can do before you even see me, and see if like that will help your health. And if that's still not enough, then you can come see me and we could talk about other things. But like, there's so many things that you can do before you even see me. And that's the beauty of naturopathic medicine, or any of these indigenous medicines, is we can grow it in our backyard. We can, we can talk about it and work on our mindset. Like, it's on us. And so that's the beauty of it.
You know what? I did have another question I wanted to bring up because I seen it on your Instagram. Also, she's on Instagram. Her personal
Yes.
Instagram is holistic. What is holistic? Oh,
It's,
Hanisha. Yeah, your
yeah.
name.
Holistic
What's her
Hanisha.
name?
Yeah.
Actually, Instagram and Facebook. You can
Yeah.
follow her personal and her business, both Mahan Health, which means great. I didn't tell you guys that yet, but now you know, which is great. We learned a new language today.
Yes.
um,
Oh,
Go ahead.
actually, I have a thought on that, if you don't mind, if you have a
Oh
second.
yeah, after you have your thought, I'm gonna have my question.
Okay. Well, when you said that you learned a new word, it just reminded me of something that I actually feel very passionately about, is the words that we say and think to ourselves, right? And like, you know this as a therapist, right? Like, this affects our mindset. But one of the things, again, I get really into history. One of the things I've realized is, so I speak two other languages, Gujarati and Hindi, and I can kind of understand Spanish to enough of a degree. And what I realized is that the English language has a lot of issues in itself, right? I
Really?
mean, I won't get into all of it right now, but one of the main things that I do have qualms with is that we embody our emotions in the English language. So what we always say is, I am sad, I am depressed, I am angry, right? Whereas every other language that I know and that I've Google translated, because I got obsessed with this idea one day, um, every other language will say, I feel. You say, I
Oh
feel
my God,
sad.
seriously?
Yes. Yeah. Isn't that
Wow,
crazy?
that is
Isn't that
crazy.
crazy?
Because I'm always, you
So
see, I have my feelings chart back here, so I'm really fascinated by the feelings.
yeah, and that's what I want to like. I want to make sure everyone realizes it's okay to feel, right? It's okay to feel sad, depressed, angry, frustrated, anxious. Like, it's okay to feel whatever you feel. But as long as we're not embodying that and telling our bodies and our mind that that's permanent. When we say I am, that makes it permanent. When we say I feel, it makes it temporary. So just being mindful of the words that we then think and say. So I will do this all the time where, you know, one of the feelings that I feel like I tend to feel most often is exhausted or tired. And I'll be like, oh, I'm so tired. And I'm like, no, I'm not tired. I feel tired. Like, that's not who I
Wow.
am. And one of the simplest examples I like to give is like, in Spanish, most people know tengo hambre means I have hunger. And
Mhm,
it literally means I have hunger, not I am hungry. And if
mhm.
you think about saying I am hungry, that doesn't make sense, because that's not who we are. Like, we're not hungry. We
That's
feel
true.
hungry, right? Yeah. So,
Wow, that is amazing. I've never heard of that in my life. And
yeah.
one of the things I always do when people, I check in, like, how are you feeling today? Like I did to you when you came on. I said, how are you feeling today? And I'll say like, and why are you feeling it? I'm feeling blah blah blah, because so that we are not like me embodying it. But I never thought about that I am factor. Wow, that's pretty incredible.
Right. Yeah. When I had that realization, I was like, oh my God. And
You
then
gotta tell people.
what?
You have to tell everybody. You got to
Yeah.
tell everybody you come in contact with.
I do. I'm like, I have to tell everyone this. This is crazy. I mean, and like I said, there's so much more to the English language, and the more I keep learning about it, I'm like, oh dear. Like, there's so many more problems, but I won't get into it all today.
The last thing I wanted you to just bring up, because I do live in Boston, Mass, and we are experiencing the winter months, is vitamin D. Tell people a little bit about vitamin D, because this is some people lack and don't even understand the correlation to their health.
Yes, yes. Oh my God. Vitamin D is absolutely essential. And Today, I will say most of us do need to be supplementing, regardless of the season, but definitely more so in the winter, because the reality is we are not spending as much time in the sun as our ancestors were. Not even close. If we spend an hour a day in the sun, that's nothing compared to the 8 hours a day, especially people of color. That's definitely something that I'm like, okay, people of color also, and that brings up a good point. People of color also need higher levels of vitamin D than people of Caucasian descent, because so the way in evolutionary biology, the way that we've evolved, right? Like I said, we originated from Africa. And from that origin, we didn't need as much. We were getting a lot more sunlight. So if we overdosed on that vitamin D, that would have affected us negatively, because overdosing with vitamin D is also a problem, and can lead to like kidney issues and all sorts of different things. So be very mindful of how much vitamin D you're doing. But so that could have been a problem. But as people moved to the colder climates and essentially got the lighter skin, the white skin, that then they needed to be able to absorb it much quicker. And so they actually didn't need as much exposure to it because they weren't getting as much of the exposure. And so it's continued to stay that way. And so that's what we see, is that optimal levels for people of Caucasian descent versus people of color are different. And again, these are conversations that I think most practitioners don't even have, but I think it's important, because, and then I also look at vitamin D at a different level. So the normal ranges are from 30 to 100, and then optimal levels for people of Caucasian descent are 60 to 80, and people of color, I usually say 80 to 100 for optimal levels. I will say, when I first tested for vitamin D, when I first started naturopathic medical school, I was at 7. So it was really bad. And that can lead to inflammation. It can suppress your immune system. Vitamin D is the precursor for a lot of our hormones. So I had a lot of hormonal issues, and that was like probably contributing to that. And those hormones are precursors to our neurotransmitters, and so then therefore it can affect our mood. So we want to make sure we're getting adequate levels of vitamin D at all times. And today, with the COVID-19 pandemic, what we found is over 80% of people with the symptoms of COVID-19 and those who were hospitalized actually had vitamin D deficiency. And so just right now I'm like, I wish the government, I have, opinions and thoughts about these things. And I'm like, the vitamin D is super cheap. And so I'm like, if like the government would just distribute that to all populations, just some vitamin D, right. Like we could prevent so many deaths right now. And so, unfortunately, that's not the way our system is set up though. And we're not in that system, but yeah, I was a walking zombie for sure.
And these, just for clarification, these are not labs that are happening on our physical, or are they?
It depends. I think now more doctors are starting to add vitamin D, but I definitely recommend asking your doctor to put on a vitamin D, because I didn't even know I was at such a low level. And I know when I checked my mom's, and pretty much everyone I know is not getting enough, especially if they're someone of color, and their levels are just generally lower anyway. And so yeah, I definitely recommend adding that onto your physical. Usually they will. Usually most primary care providers will, because people are starting to realize like all the importance of vitamin D.
Okay. Oh, that was a lot.
So much.
I never took a deep breath after a podcast, but I just feel like I was taking so much notes. I'm like, man, this is so good. This is so good. This is so good. You are amazing. And the way that you're able to share the knowledge to us, you make it in such layman terms that it's digestible. Like, all I know now is I want to fight off the bad guys. So I want to do everything I can. Your analogy was so helpful.
Oh, good. I'm glad. I do think about that all the time. I'm like, I'm nourishing my body. I'm feeding good guys. Like, look at me. I'm awesome. Like, I have these conversations with myself all the time.
Oh my gosh. Well, thank you. Is there anything else you want to say before you go?
I don't think so. Yeah, I think we covered a lot. Yeah, and well, I guess one last thing I do want to say that, I mentioned a lot, but I think the most important thing is to give yourself grace throughout that process, right? Like I talked about a lot of different things. Figure out which of the things that I talked about you can start to incorporate now, and leave the others for another time, right? Don't overwhelm yourself with any of this. Just find what resonates with you and go with that and give yourself grace.
Yeah, I will say she's right.
Thank you.
This is the last thing I'll say, but when I was trying to lose weight after I had my second daughter, I was going to the gym, but I was also going to Burger King's after, and I was trying to figure out why I wasn't losing weight. And then I had to understand it was what I was eating. So I was like, oh, let me just start eating healthy, right? And so I went and got all of these greens. I'm like, I'm going to eat healthy, and they all went to waste because I was trying to do a huge transition. I mean, now it's different. This was about 7 years ago. And so I always tell people that story because what you're saying about giving yourself grace is important. Changes take time, so it's the little things you do, even if it's like, you know what, I'm going to change my breakfast routine up, or I'm going to change my dinner routine up, right? Like just little by little, every step counts, but you have to start somewhere. Right. You can't, it's not going to happen by like, oh, this is good, wanting it to happen or hoping it happens. It really starts with you. And it's a hard transition, but it's important.
Yes, definitely.
Thank you. I appreciate
Awesome,
you so much.
Thank you. I appreciate you having me. This was super fun.
Good. That's the goal. So people can keep coming back and share.
For sure. Yeah. Thank you.
Bye.
All right. Take care.
This was good. Thank you all for listening and your engagement. This was amazing. And I was so fascinated by listening to her talk, and like I said in the beginning or within the podcast, I learned about this, and just a few years ago, and I'm 38, and I feel like that's pretty sad, and I don't feel bad. Like, I don't feel like, oh my gosh, I don't beat myself up about it. I mean, it's pretty sad that we don't learn about this stuff, on a regular basis, I think, so that's why I'm grateful that people agree to come on the podcast and kind of talk about what they do, because I look at our healing process and our mental health in, a holistic way and not in a linear way, but looking at everything. So she is amazing. So again, she has a podcast. Make sure you subscribe to her podcast, streaming on all podcasting platforms. Mahan Health, and it means great health. Who doesn't want great health? And, one of the things about, what we don't know, it's important for us to try to digest the things. And so a podcast is a great way to digest some new things about, what you want to learn. And we'll be back. Actually, we'll be back Wednesday. We won't be back Thursday, but we'll be back Wednesday talking to Romney Malco. So that should be fun. We're going to be talking about our inner critic. So make sure you tune in, and you can find this episode. It'll be streaming on all podcasting platforms. And until next time, I will talk to you guys later.
Smile, every hug, every kiss, every touch, every person in my life that I care about and love. But wait, maybe I'm getting too emotional. That's exactly what they say you ain't supposed to do. Suppress your feelings, never talk about your pain. Can't appreciate the sun without acknowledging it rains, right? That's right. So this a moment of clarity, and make sure you always protect your energy. You stay focused and your life